To Arizona and speak to Zaheer Shah, a doctor who's a specialist in internal medicine. Doctor, thank you so much for your time. What was your reaction? Did you smile? Did you laugh in wonder when you heard that the president is taking this drug?
No, I don't think laughing would be the response that I had. I shed a tear for the loss of science and rationality in American discourse. I think what we're witnessing is an unprecedented departure from rational thinking by the leader of the free world. And I'm concerned deeply about the consequences of this sort of rhetoric being cast out by our president in terms of the danger and harm that it could cause American citizens, and for that matter, citizens worldwide.
But do you think that more American citizens will be taking it? Presumably, you need a doctor like yourself to actually write a prescription out for any potential patient who wants to take hydroxychloroquine. And why, for example, you wouldn't do it, judging on what you've just said?
Well, I think we're all caught up in some echo chambers. And what's interesting is that science is becoming weaponized and it's becoming politicized. And so I'm becoming concerned that there may be a segment of the physician population and other medical providers, because in America we also have nurse practitioners and physician assistants that can prescribe. And I'm just concerned that some of them may also be swept up by the rhetoric that is coming out of our White House in justifying the prescribing of this drug without any rational or scientific basis to do it. I mean, just look at the fact that the two most august bodies that dictate how to treat an infectious disease in America, the FDA as well as the IDSA, the Infectious Diseases Society of America, they have both gone on record with public declarations that say that hydroxychloroquine and chloroquine should only be used in the setting of clinical trials. It is not a preventative. It is not a drug to use to treat either mild or moderate COVID-19 or severe. In fact, any science that has been done to date has indicated that it has absolutely no benefit, and I think the potential risks of it are fairly well defined.
Yeah, absolutely. The FDA also saying that it's highly recommended that hydroxychloroquine is not taken outside of a hospital setting. You mentioned the science. How worried are you, apart from the fact that clearly science has become politicized and weaponized, but that science itself may suffer a damage to its reputation simply because, as a new coronavirus, and we're now since December, almost 6 months into this global pandemic, and we're still learning so much about it, which parts of our body it affects, how it reacts inside us, how we recover, what long-term damage may be caused to us of those who have recovered. That as the science is still learning about coronavirus, people, especially politicians, are saying, well, the science says this, so therefore this is our decision. And yet the science itself is not completely clear. And how can it be when we're still learning about COVID-19?
Well, these are unprecedented times. I've been practicing medicine for 25 years. I vividly remember in medical school being told by the professor of microbiology and immunology that was teaching us about virology and about epidemics and pandemics. He said, listen, this is not a matter of if, but when. So we understand that pandemics are a part of the biological cycle that viruses engage in. So even though this is shocking and disturbing for us, and in my 25 years of practice, I've never seen anything even remotely like the pandemic that we're living through. But the reality is that this is a biological phenomenon. This is a well-established cyclical event. We know that in 2002 we had SARS. In 2012 we had MERS. These were both also coronaviruses that were actually more lethal than the one that's responsible for COVID-19, but were just not as infectious. So we know that these viruses come and that they pose an existential threat to human beings. And now what's interesting is that here we are in 2020, where suddenly our response to it is not predicated on the best science or on the best scientific leadership in America, but it has literally become a football that is politically available to both sides of the aisle here in America, and different political interests are advocating different approaches to it. And I think that this is very disturbing because this is a departure. I think if you look at the history of America, particularly if you look at us from World War II on, we have always allowed science to dictate and guide our policy making when it came to biological threats like this. And the world has always turned to us as being the leaders of scientific inquiry and discovery in enabling us to find solutions to difficult scientific and medical problems. I think what I fear for is that this departure from rationality, this departure from science, in the name of political expediency, in the name of perhaps somebody trying to preserve their political viability, that what we're doing is we're creating a fundamental chasm here in the populations and in the general public's reliance and belief and confidence in the veracity of science. And so, in many ways, I bemoan the loss of science. That what we're doing here is we're killing one of our most sacred forms of inquiry.
Doctor, you know what? I was going to ask you how exasperated you feel when the President of the United States says if we did less testing, we'd have less cases. But you've just answered that question. Thank you so much indeed. Zaheer Shah, doctor in Tempe, Arizona. Take care.